Thank you very much to the folks from the media for joining us here today. This has been a consistent press event that we've put together on Wednesday mornings at 10 to bring really the view of the regional governments, the county chief electeds. Today, we're joined by Marc Poloncarz, the county executive from Erie County, and we're also joined by the county executive of Dutchess County, New York, Marc Molinaro. Both of the gentlemen here and the other county executives from around the state operate as really incident commanders. There are emergency management coordinators or commanders that are responsible for states of emergency and for executing the policies during an emergency at the county government level. Both of them interact on a daily, minute by minute, hourly basis with their local health commissioners and are responsible for protecting the public health. Yesterday, or a couple days ago, the governor talking about the phases of reopening, a very critical announcement that was made in Monroe County, New York, where the governor outlined some of the 7 steps that are necessary to begin the process of examining how, where, when would it look like for our communities to begin to reopen, what types of industries would be able to reopen, the various categories, a scorecard put together by the state, the governor outlining a 7-point plan. The county executives met last night from across the state, talked about a lot of the issues of the 7-point plan, which of the 7 components does the local government or the county government, as these health departments are regulating society right now and conducting various consumer protection programs that are administered by the counties. How many of these 7 components are under the influence or control of the county government? And it's readily identified that there are 2, that there are 2 of the 7 that are directly influenced by the county government. The first of those being the number of tests that are required, 30 viral tests per 1,000 residents, conducted on a regional monthly basis. And the other one, of course, the contact tracing component of 30 working contact tracers per 100,000 residents. So we're starting to look at this chart here. Shows you the first chart here we want to show you is you look at that far right column where it says second to the on the right hand side, at least 30 contact tracers per 100,000 residents. If we look at the 2 if we look at that column that says at least 30 per 100,000, here we're talking about a region. So if we look at Marc Poloncarz's region of 414 contact tracers per 100,000, that's the target for the state. You can see in that far right column in Western New York what the governor mentioned, how many of those 7 has Western New York met so far, around 3 out of 7, but this changes by the day. But here we wanted to just focus in that 414 is needed in the counties that make up the Western region. What we don't know right now is how many specific contact tracers are in place already. So what are we doing? Well, I'll let the county executives speak about that when we ask them a few questions. But what we are doing at the county level is repurposing, realigning our existing staff where possible, and reassigning them to act as contact tracers. And we're also working with the state of New York to develop a system. We do expect the vast majority of those 414 tracers in Western New York to be employed by the state of New York. So, or contracted, maybe not employed, that might not be the right word, but contracted by the state. So the county government, nothing new, but to both Erie County and Dutchess County on contact tracing, that's what they do and have been doing for decades. But what is new is the amount and the volume that's necessary to meet these targets. But we do expect the state of New York to be contracting for the vast majority of those contact tracers and to work in coordination with the counties to integrate the county's effort on contact tracing. The other piece I wanted to talk about here of these 7 factors is the number of tests that are conducted per month. And here we wanted to show a couple of slides of what has been happening across the state. If we look, of course, at the downstate region first, the red bar here, the red charts show the targets, the monthly goals as established by the governor. If you look at Nassau and Suffolk County, no surprise there with the epicenter coming from New York City and also into Long Island there, you could see the number of testing exceeds the target. And so if you look at New York City, Long Island, you see that. And then you begin to look at the lower Hudson Valley. Again, that's going to be reflective of Westchester, Rockland County, again, with the pandemic starting in New Rochelle, which is located in the lower Hudson Valley there in Westchester County. You could see the number of tests that have occurred there versus the target goal. And then again, in that mid-Hudson region, you could see that they too have exceeded the goals for testing and the capacity to test, or these are the actual number of testing, just taking a 7-day average week from data of April 28th to May 4th. If you go to the rest of the state, and we show a chart here looking at some of the other regions of the state. Okay, so here's the, thank you, Mark. Here's the rest of the state. So again, that red bar chart showing the target that's needed in Western New York. We looked at Western New York. We have Marc Poloncarz, the Erie County executive, on there. His challenge is how to meet that 41,000. And if we look at the other areas of the state here, how do they fare here with meeting the monthly goals here versus the actual tests that have done? And here, none of the indicators here on testing will have met the state's goals. So what does this mean for the counties? They're going to be working to continue to implement, and as the two county executives take a few questions, they can describe the efforts that they have taken so far to establish mobile testing, or working with their hospital system on expanding testing, working with their local health departments. What have they done to achieve the numbers that they have to date? So those are the two of the 7 indicators that the counties are directly involved with, and will be working very closely with the state of New York. The next thing I wanted to talk about here is a new report that NYSAC is releasing today. This is an economic impact. There's been 2 prongs of this COVID-19 virus that have affected the state of New York and the counties, both the public health crisis and also an economic crisis. And today, NYSAC is releasing a report that could impact the counties of New York. And I know both executives will talk about the economic impact, approaching now $3.5 billion in lost revenue. Really, counties are seeing a decline in 4 ways: declining local revenues, especially sales tax, but also hotel, motel occupancy tax, mortgage recording tax, gaming revenues, and other local fees that were used or are used as part of a regular course of government. Of course, higher spending necessary to respond to the emergency, the loss of potential state reimbursement, and the fourth, a potential and significant loss of small businesses within their community and on main streets as the economy realigns itself when we reemerge. So we will be putting out a new chart. When we did an economic impact at the very early stages of the pandemic, we showed a loss of about 4% to 9% in a mild scenario of economic loss. And now that has jumped to almost 10% or 9% from the 4. So the early days of the pandemic showed about a 4% hit to sales tax, but as we now have more data, 6 weeks going through this, it's doubled to almost 9 or 10%. And on the severe scenario, it went from 12% on the severe side of economic loss to almost 22%. And that really starts pushing this towards about $2 billion in just sales tax losses alone. So the last thing I want to say before we start our conversation with the county executives is the need for federal stimulus funding. Counties need a federal stimulus package to address the revenue losses that we just talked about here. It is very difficult to discuss reopening or in any capacity, whether it be a slow rollout, a 60, 90-day, 120-day rollout of re-emerging from this, without the federal resources to help offset the losses that we have sustained. And that's why we have called upon Senator Schumer, Senator Gillibrand, and the entire New York congressional delegation to dedicate county funding directly from federal resources. We're confident that when they are able to reconvene and reach consensus on this, that there will be a package. But the report that we're releasing today really lays out why this truly matters to the counties of New York. So let's get started here. Let's go to Western New York, to Erie County, which sits, of course, on the border of Canada, a very peace bridge connecting the two countries, a very important economic relationship between Canada, the United States, and Canada and Erie County, Canada, and the state of New York. Marc Poloncarz, you still see some positive numbers of infections, and you also still see a number of hospital admissions, deaths related to COVID-19. How do you balance what the governor has outlined for us between talking about reopening when we're still starting to see, when we still see the rate that we're seeing with hospitalizations and infections?
Stephen, thank you. First off, I want to thank NYSAC for hosting this event and being a strong advocate for us. Steve and I were actually on the phone with his national counterpart, Matt Chase, this past Friday after I spoke to Chuck Schumer about issues associated with the stimulus. And we've been a strong advocate for the counties, and we are the front lines of the response for COVID-19. We are running the health departments. We are running the emergency services departments. We're working in direct contact with the hospitals, and some of our counties, of course, own hospitals. Erie County no longer owns a hospital. We have a very close relationship with the Erie County Medical Center. So I've been spending a lot of my time on the phone with the CEOs of hospitals to find out what their needs are. We've been procuring PPEs for them through New York State. And throughout this entire crisis, it's counties that are at the lead. So it's very important that we receive the resources that we need so that we can continue to serve our public. And that goes from the money that Erie County was able to receive from the CARES Act, but I know my friends in smaller counties like Dutchess, unfortunately, did not receive CARES Act funding, and why it's so important for them and others, including us, to have another round of stimulus funding. Erie County itself is facing, based on our budget projections, approximately a $220 million budget deficit due to lost revenue. We've lost it in sales tax. We've lost it in hotel tax. We've lost it in mortgage recording tax. The traffic that Steve talks about between the United States and Canada, which passes right through Buffalo, and I can see it from my office on the Peace Bridge, has basically dropped to a trickle, only essential travel, and a lot of the companies that rely on the logistics and other types of businesses for the cross-border travel are, of course, closed at this point. So we are in a significant financial situation here. We continue to work with the governor's team as well as others to try to meet the parameters that he set forth with regards to those 7 to 8 indicators. There's a number of indicators, 3 that Erie County has already met. I'm not taking any time. We are repurposing existing staff to be contact tracers. Based on the formula of 30 per 100,000, we believe we need 277 contact tracers to meet the formula that the governor came up with. So we actually have about 20 contact tracers right now. They've been able to handle the workload. We are going to take staff from the Department of Social Services, the Department of Senior Services, and other areas, and train them to be contact tracers, because I don't know how long it's going to take for the state to make that, to hire all those contact tracers that they want. But we have many staff outside of the Department of Health who already have access to the Healthy Link program, so they can access the data. They just need to be trained as a contact tracer. So that's something we are doing internally so that we can meet that metric as soon as possible. I feel much better about our testing metric. We weren't that far away. We've determined it's a little less than 300 additional tests per day for all the testing labs in Erie County. For those of you who are downstate, we were struggling to get any tests for the longest time. And I mean supplies, the swabs, as well as the reagents. I was literally on the phone every day with the governor's office trying to get another 200 swabs, another 200 reagents. Thankfully, that's less of a problem now. And so we should be able to meet those testing requirements very soon. Unfortunately, our hospitalization data lately has not been great. Though the last few days, we've seen a downward trend with regards to hospitalizations, as well as discharges exceeding new admissions. And the most recent data that I have for May 4th, I had a pretty good drop. We'll be announcing that very soon, as well as hospital discharges exceeding admissions by a significant amount. So that's a good thing. And it's always a good thing when discharges exceed admissions, and you also don't have many deaths that day. And based on the data, we didn't have a whole lot of deaths. But we're still dealing with this. We're like a lot of other parts of the country. We're not New York City. We're not Long Island. We're not Westchester. But the numbers in Erie County, we have more cases and more deaths than Allegheny County, Pennsylvania, where Pittsburgh is, and Cuyahoga County, Ohio, where Cleveland is. And both of those counties have 300,000 more in population. So it's not just a per capita basis that we're worse. It's also just on a general gross basis. So that kind of scares me, because you can't do a comparison with New York City, but we can do a comparison with our peer group of Cleveland and Pittsburgh, and we're not doing as well with regards to cases and deaths as they have been. So that lets me know that we still need some more work to do before we can get to the point where we feel comfortable that reopening will not set us back. So we're going to do what we need to do to ramp up testing. We're going to do what we need to do to get the contact tracers here. Hopefully, in the end, we continue to see the downward trend with regards to hospitalizations. And when it comes to the finances, we must have a stimulus package 4.0. If we don't have a stimulus package 4.0, we're going to have to do drastic cuts across all county departments. A worst case scenario is what we're looking at. And I've asked all departments to come up with a plan to cut by 13.1% of their budgets, which, because it's going to be in the middle of the year, it's going to have to be, that's 13.1% annualized. That means they're going to really have to come up with a 25% cut if we can't get the assistance from the federal government that we deserve on being on the front line. So I join my fellow county executives and leaders, not just in Erie County and New York State, but across the country, who understand the importance of the next federal stimulus package assisting local governments. And that funding must go straight from the federal government to the local governments, just like they did with the CARES Act. It should go from the feds to the local governments, so we don't have to wait for it to go through New York State and then potentially be transferred later. So with that, I'll turn it back to you, Steve, and look forward to hear from Marc.
Thank you, County Executive. If we take a 6-hour ride east and we end in the Mid-Hudson Valley, another beautiful area of the state of New York, Marc Molinaro, the County Executive of Dutchess, you've talked recently about the need to be aligned in a region that is more reflective of the Mid-Hudson Valley as opposed to the lower Hudson Valley. Of course, with the epicenter starting in Westchester County and Rockland County, and the density of the numbers of infections in that particular region of the state, you've stated that it makes little sense to be tied to really a regional economic development council region that really is involved with economic development and not necessarily a public health relationship. Can you talk a little bit about the governor's 7-point plan and how that affects your thinking of being in this particular region in the Mid-Hudson?
Yeah, Steve, first, let me also join Marc. A lot of Marcs on this call. I just really commending my colleagues. I think what we've seen all across the country, and certainly you know this in New York, and we're reiterating it now, the response to any emergency is generally local up. And this, of course, emergency affects every corner of the country and every community in New York, certainly. And county governments are really the tool that gets used in many ways to effectuate the outcome. So whether it's propping up test sites, as we did, Ulster, Dutchess, Orange, coordinating, commandeering and contracting for the tents and the test kits and working with our hospitals and healthcare providers to make sure there's access, or it's, as we know, identifying the confirmed positive cases and then tracing those contacts. In this state, the county governments act as an arm of the state government, and our responsibility is to effectuate those outcomes. And so we've seen county governments really be the lifeline for our residents, and with our partners in local government, and really the front line for the state and national government. So that's clear, certainly in this state. To your question, I think more broadly, we're now in this very gray period, which is we're not entirely closed and we're not yet open. as gray as that area is in the decision making, so too is the Mid-Hudson Valley. We are logically a region that includes Westchester and Rockland. There is a region that is the Mid-Hudson Valley or the Hudson Valley region. But when it comes to public health and the response to this epidemic, there's a stark difference between the lower Hudson and the Mid-Hudson. And so the three counties, Ulster, Orange, and Dutchess, have been coordinating from day one. In fact, the first positive case in Ulster County was a resident who was in Dutchess County. And the three county executives, we have been communicating, coordinating, and interacting with one another over the course of these last several weeks. We've asserted, and I think rightfully so, and later this week are organizing our partners in some other counties, Sullivan, Putnam, Columbia, Greene counties, along with us to begin a more aggressive effort to collaborate, to discuss best practices, to identify areas of concern, and to work really with the state and others to both monitor where we are, the status of the pandemic and the impacts on individual lives, and then also the restarting of community economy and government activities. So we think that that's logical. To the governor's framework, this is what I've said this before, and I don't think this is disrespectful. Whatever we think we're planning on today, I can assure you we will change tomorrow. This is a crisis that is impacted by so many variables. So I take the 7 points as the framework. The Mid-Hudson region can meet some soon, others not. Access to testing is critical, not just standard diagnostic testing, but the rapid testing, very, very critical. We don't have access enough there. Dutchess and Ulster and other counties began last week testing in nursing homes, getting access to those test kits. We're working with the state to do that and our partners to do that. But in order to keep the testing regimen going, we need greater access. The other is that we've tested a lot of people, and the protocols for testing have historically been CDC guidance, symptomatic, some potential that you've traveled or that you've come into contact. Well, as we get through the next wave of tests, there'll be fewer and fewer of those people. So keeping pace with this high standard of regularized testing, and then add to that, when people start getting back to some semblance of normalcy, they may not be willing or interested in being tested, and therefore that standard will become more and more complex to meet. But the bottom line in that regard is that county governments are going to do what's necessary. We're hiring and expanding our capacity to do contact tracing. We have a great team, 9 separate teams, 90 individuals made up of county staff and public health and other departments redirected. We have volunteers through our Medical Reserve Corps that are partnering to provide the service. We'll be able to keep pace. But I think the real challenge is as we restart and reopen, whenever that is, we hope it's beginning in around May 17th, that the necessity for all of us to be honest and forthright about the information, to be brutally honest about what we expect from the public, to express what we know and what we don't know, and to be clear that we're going to take the steps necessary to protect lives while helping people get back to their own, is critical. And I just would offer, I think county governments can be the right role for an effective reopening. It is going to be more complex getting out than it was getting in. And to that end, like Erie, Dutchess and counties across America are facing significant revenue losses and financial impacts. For us, that could result in this will result in a substantial sales tax reduction, which could total some $75 million in lost revenue. Add to that costs that we think some of which will be reimbursed, some of which may not. And without that clarity, you run the risk of destabilizing some of the most stable employers in our community. County governments have been responsible with finances. We have high bond ratings. We're big employers. We don't need that lack of stability. And certainly the public needs us to do the job that the president, the governors, Congress, state leaders, local mayors expect us to do. So I join Marc and our colleagues in really calling on Congress to find it within their political will, the necessity to guide direct aid to county governments. We're providing those services. We want to do it well. We want to be responsible to our taxpayers and our residents. And without that aid, there's not only the chance that we can't keep pace and meet the demand, but we'll have significant instability at this level, and that just isn't something we can afford to have happen. So I look forward to any questions, and I'm grateful for the time to be with all of you this morning.
Thank you, County Executive Molinaro. The governor has talked about the gears of society, the gears of the healthcare industry have to be connected and they have to be working in concert together to surge and flex during a time where the pandemic was on the rise and we were meeting and trying to flatten that curve. It seems now, in listening to you two gentlemen, that local government, in particular the county as a regional government, plays a major role in this next phase as we move through, confront the economic injury here, the public health crisis. Of course, counties have local health departments. Counties are responsible for emergency management. It seems like the communication now needs to change, and the manner in which the governor is communicating with county governments now needs to change and needs to adapt as it's becoming more acute with the public unrest. We're heading into the warmer months now. We're seeing this around the country. Marc Poloncarz, can you talk a little bit about how you see the public reacting to the continued closure? I know you've had a few folks outside demonstrating, around a few hundred folks talking about, we've had enough. No county executive, no county official is asking to reopen in an irresponsible, unsafe manner, that it needs to be coordinated by the state. But it seems that the role of the county in maintaining the rule of law and moral order in society now, it becomes more and more important as the days continue. Marc?
Yes, Steve, we certainly have seen some protests here. I think the vast majority of the public understands where we are and is very accepting, though based on just the anecdotal evidence we had from having a good weekend this past weekend, people are getting out. They want to get out there. They want to enjoy what would normal be the opening up of our summer activities. Buffalo can be pretty cold and difficult in the winter. And when the sun comes out and it warms up, people want to get out there and enjoy it. But part of the problem is we're still reminding them they have to follow appropriate protocols. Even if they don't get sick from COVID-19, we all know that they could be an asymptomatic transmitter and pass it on to someone else and kill them. So we have and are continuing to deal with that. I'm just like everyone else. I need a haircut and I haven't had one in 2 months. My hair hasn't been this long since high school. And I see Bob McCarthy from the Buffalo News on with a beard. I don't think I've ever seen that before. So I think we all understand that we have to go about this in a manner that protects the general public. And that is not going to be well received by everyone because while I agree we need to do this in phases, there seems to be an expectation among many in the public when we talk about reopening, there's going to be this mass reopening, and that's not it. Nor should there be. There shouldn't be a mass reopening. But a lot of the manufacturing in Western New York has continued at a lower capacity than what it once was, but it has continued. Essential construction has continued with regards to governmental projects, but I know there's a number of major construction projects that are sitting basically just vacant, structural steel that's up with nothing else for the last month. And those are important projects for our region. So we do have to be able to do the balancing act that the governor talked about yesterday, which is the lives are more important in the long run than dollars, but we also have to understand that we cannot continue in this current mode. So that's why we keep on pressing here for the general public to follow the protocols with regards to smart social distancing, to wear your mask in public, so that people understand that we wear it not just to protect ourselves, but to protect the other person. We have to be our brothers and sisters' keeper if we are to move forward. I'm hopeful that the people in Western New York understand that. Some are angry. There was a protest in front of the Rath building last week, and right now I'm hearing a lot of honking in front of the Rath building for the last 10 minutes. So I wonder if there's protesters out there right now. It's the type of situation we're in, but we need to do in the long run what is best for our community, which is protect the public's health and find a way to balance it through the multi-phased opening. But the thing that I fear the most is that a lot of the general public seem to think when we talk about reopening, there's just going to be this general reopening. I get a lot of questions about youth sports leagues and athletic leagues. And it's tough to tell them that I don't think we're going to see youth sports all summer. I would love to see that, but I don't know if it's safe. And we need to do what's safe to protect our general public before we move forward and just do a mass reopening that could potentially cause problems. And according to my staff member, it appears there is a protest going on right now outside my office with cars and protesters, which That's the beauty of America. They have the right to do that. But we also have the right to say we need to do what's correct for our community.
Thank you. Last question from Marc Molinaro, the County Executive of Dutchess County, before we take some questions from the media partners that are with us. Marc, the counties are not in any capacity designating essential or non-essential businesses. That is strictly a function, a declaration of the state of New York using the emergency powers of the state to designate these types of businesses. I've had conversations with you over the last several weeks about what the economy might look like, what Main Street in Poughkeepsie might look like when we return or reemerge in the town of Wappinger and the small towns and these businesses that existed. Will they survive? What will Dutchess County look like as we slowly reemerge? Are you concerned about the future of small business? And what are your thoughts about what life will look like in Dutchess County as we begin to reemerge from this?
Well, I'm first impressed with your knowledge of small town America in Dutchess County. The people of Wappinger are grateful for that. But I will first tell you quite candidly, for some small businesses, this will feel more like the Great Depression than recent recessions. There will be businesses that will not open again. And that shouldn't be cast aside as just a casualty of war, so to speak. These are livelihoods and dreams that quite frankly may not restart, and that is a reality. And to Marc Poloncarz's point, we all agree that whatever reopening looks like, it needs to be slow, steady, and careful. We also need to be realistic. We are in a new phase of our response, right? It was control the fire, and now it's diminish the flames. And then it will be time for rebuilding. We are probably in the diminishing the flame zone. And that I think is critical, and also requires us to alter the way we respond and communicate with one another. It's a different phase of the response. To your specific question, life is going to look a lot different. What we've learned is that certainly businesses can adapt relatively quickly if they're given tools do it. So the financial support from the federal government is critical. It's been slow and sluggish. Farming finally this week now having access to resources. But that said, small businesses, real true small businesses, are going to need to help to prop up online platforms so they can convert some of their business even more so to a digital platform. We've convened all 20 towns, 8 villages, and 2 cities to develop a sort of relaxing of zoning and building code to enable businesses, retailers, restaurants to take advantage of public space, to expand outdoor capacity in order to limit indoor capacity. We've given them best practices to limit, to enhance social distancing, but limit the sort of social gathering. They're going to need technology to do it. They're going to need some latitude within regulation to do it. And so from our perspective, we're preparing for that. We're setting the stage for, as this slow incremental restarting of community activity begins, they'll be given latitude. We conducted a survey of every business owner in the county. We're, as I said some weeks ago, restarted our reconstitution planning with them. I think that's all critical, knowing that the door is only going to slowly inch open, and it's going to be based on data. And we don't want to be in a position where we're risking lives. That said, I do think in many ways we will be stronger after this. It's just the aftermath is going to be painful, as it is already. What happens when folks have to start, paying the bills again? And some, of course, are carrying the load. Some can't afford to do it, and they're going to have to work out arrangements. What relief is there going to be, both emotional and fiscal, in order to allow these businesses to function again? And for all of us, most of our jobs come from small business owners, and they're going to be the hardest hit in many cases. So we're working to make sure that pain is as little as possible. But I really want to reiterate, in this new phase of response, we need to demand at all levels collaboration. We need to be exceptionally clear about what we hope to achieve. I think we need to be brutally honest about the risks of any decision. And we have to be utterly specific about how and what we expect from the public and with the public. And I'll just end by saying that this is one of those moments where, local governments are critical because the public tends to trust us a little bit more. That's not to say they distrust everyone, but in the time where most people I don't want to be told something that they don't necessarily agree with by people they don't necessarily believe. We know that local government officials, because of our relationships, because we're at the grocery store, have a degree of trust. And so we need to use that effectively to be specific, to be honest, to ensure collaboration, to be perfectly clear that what we're doing together is going to take some time, and that we're deliberate, responsible, and aggressive in getting it done well.
Thank you, County Executive Molinaro. So a day in the life of two county executives, two incident commanders who are responsible for executing states of emergency in the mid-Hudson Valley of a population just shy of 300,000, and in Western New York, in the county of Erie, with a population just shy of 1 million people. Gentlemen, thank you very much. Marc Levine, if we could now see if some of the media partners here have some questions for the county executives, we'd be happy to do that now.
Great, thank you, Steve. For the reporters on the line, please, if you have a question, indicate that by raising your hand or sending a chat directly to me. The first question is from Susan Arbetter, and then she would like to know if either county executive has furloughed employees or plans to furlough, and if so, how many employees and when?
I'll go first. We have not furloughed employees yet. I've been paying every employee, including those that are sitting at home, and those that are deemed not essential. Though we do have as I said, a proposal to the departments to cut 13.1% of their budgets, that if we do not get the federal aid in, we would start to have to start in all likelihood late May, probably more, not late, middle of June. I made a conscious decision early on to continue to ensure that all employees are paid because our economy was getting damaged enough. I didn't want to have more employees basically be put on the unemployment lines, but we cannot continue this forever. So we are planning on potential layoffs. I've had discussions with some of the unions with regards to furloughs. They're not really too keen on furloughs, though I've given them the option to say, if I have to go to this point, I'd much rather do a furlough than a layoff. I'm hopeful that they will agree with that as well. But right now we haven't done it, but we would have to do it in probably a month if we didn't get any additional aid to cover those budgetary shortfalls I talked about.
We're in this sort of the same position. We made the conscious decision early on that furlough or eliminating positions at this point would just shift the burden to some other level of taxation. So from our perspective, keeping our employees employed at least will support the local economy to the extent that's possible, and of course their own households. We recognize that in many cases there are people home not making any money. There's no paycheck coming in, and so we have to be sensitive to that. But the truth of the matter is we just didn't want to destabilize. But we've had this conversation with our state leaders and certainly with Senators Schumer and Gillibrand. Absent federal assistance, there will be massive layoffs at the government level, and that will be a different wave of unemployment that I don't think is in the best interest of the national or New York's economy when and if or when we start to reopen again. I will tell you though that so we, like every county, we've frozen travel, we've frozen training costs, we've frozen as many capital projects as we can. No new hiring except a nominal number to fill in sort of the critical roles that we still have to address now. And absent some assistance, as I said, we're looking at somewhere between $40 to $75 million worth of revenue losses, which could translate into as many as 215 jobs. We're hopeful not to go in that direction. But that said, we haven't downsized at this point. We have a fiscal team that meets daily to sort of review where we are. Like Marc and other counties, we'll know a little bit more about sales tax later this week. That'll be a good indicator as to the depths of the hit, so to speak, and we're prepared to react appropriately.
I just want to add one more point. This is not just a county issue. This is a local government issue as well. For example, Erie County sales tax is 8.75%. The first 4% goes to New York State. The other 4.75% goes to Erie County. But we share 46% of that portion that we receive with local governments, including the city of Buffalo, the city of Lackawanna, city of Tonawanda, the towns, our villages, and our school districts. So the sales tax revenue loss is not just impacting Erie County, it's impacting every government in Erie County. And I know many other counties are in the same position where they share their sales tax revenue with their local governments.
Thank you very much.
You're welcome, Susan, and I hope you're well.
Susan has a lovely home that she broadcasts from.
I'd like to go to Jay Platsky now. Jay, your mic has been unmuted. You can ask your question now.
Thank you. Jeff Platsky from Gannett Newspapers. I have two questions, one with a follow-up. One revenue hit you haven't talked about is delinquency of property taxes. Can you talk about that and what you expect the future to bring with property tax delinquencies?
Mark, I'll jump in first to say that, the short answer is we don't know yet. Village taxation will begin shortly, which will give us a bit of an indication, at least as to what folks' tolerance and capacity to pay is. School district taxes follow. In our case, and I think the same is true in Erie, and you, Mark, will correct me, but in our case, failure to pay village taxes is the responsibility of the county to make those municipalities whole. So keep in mind, we run a double risk, which is as we get closer to our tax period, which at this point there are still those who haven't made full payment, but we're nearly full as far as payments to county government. That said, we'll know the what to expect, I think, as we see village and school taxes, and then be prepared for that. But failure to pay your town and your village tax means that the county, in my case, has to give and make whole resources to the village and town. So we run the double risk come later this year, next year, of individuals not being able to pay county taxes and the counties having to subsidize the villages and towns for failure to pay their taxes. And that's, I don't know that we can say with certainty what the depths of that impact is. We'll know more, I think, over the course of the next 90 days.
I agree with Mark. We thankfully our property tax collection for the county and the towns was basically in February and March. So as this was just starting in New York State, we were collecting our property taxes. As a county, we generally receive 94% of our property taxes that are due, and then we have to go and collect the rest through our normal protocols, which usually take a number of years because you can't foreclose as a county on property taxes until, for us, at least 2 years down the line. We are worried about the impact it's going to have on the villages, and then the city also has a different taxing time, and that will certainly have an impact when you're talking about individuals who just don't have the money to pay mortgages, nevertheless their taxes. I am worried about what's going to happen. And I have heard anecdotal evidence from some of the banks locally that their mortgages payments are coming in a little lower than they normally would. I'm fearful about what that will mean in the long run with regards to the taxes that are received to the other governments. We're okay with property taxes for 2020, though I know that this is going to drag into 2021, and the impact it's going to have with regards to individuals at that point is also going to be concerning.
Now I'd like to go to Ryan Whalen. Ryan, you have a question. You have been unmuted.
Thanks. I'm going to try to sneak in a couple here too. And good news, Mark. I told the newsroom about the protest outside and they sent somebody over and they're all gone, so you're clear.
It's not big, but there's a few cars out there.
The first two are just points of clarification because I've had some confusion at the state level. When it comes to the testing conditions to reopen, and they talk about capacity, is that the actual number of tests that you are actually conducting or the stockpile of tests you have?
My understanding is a test we're conducting. Stockpile will come and go on a weekly basis, but we have been able to increase working with our partners. The county, of course, has its own drive-through clinic, but the state is open to drive-through clinic. We have the hospitals have been ramping up their testing. We have 3 major hospital units here, and one of them is really ramped up its testing tremendously. If this protocol had been in place 3 weeks ago, I'd be much less certain that we'd be able to make it in a short period of time. But because of the way we've been able to ramp up, it is, I think we can. Now, there's one thing we are seeing, which is some of the clinics are not being as used as they should. So we've opened up the clinic slots to basically any individual, at least in county government, who feels they may have been exposed, even if they're asymptomatic. Because what we were seeing by just testing symptomatic personnel is we weren't getting full clinics. People were not calling. So now we've opened up our clinic, and I know other hospitals are as well, to any individual who feels they may have been exposed. But there are limitations on that. If they were exposed 3 months ago and they no longer, or 2 months ago, and they no longer have the virus, it's going to come back negative. So we're doing those type of tests, and we're also ramping up the antibody tests. But the antibody tests do not count towards the number that the state says we need to meet as a region.
And with regards to the tracing army, has New York indicated to you that they plan to have those people hired by the time the May 15th executive order is supposed to expire?
I don't think so. I'll leave it up to Stephen and Marc, but we've had some conversations about it. I'm just going to take existing staff that I have, and we're going to train them to be contact tracers. So if it does take them a while to ramp up, I don't have to wait because I've got the people on hand. And the thing to note too is we have the ability to do contact tracing for all people who are testing positive right now. So it's not like we're not contact tracing. We are contact tracing, and we can handle it with the contact tracers we have, which are Department of Health staff. But we have to ramp up, so we're going to ramp up, and I'm going to utilize the staff I already have.
And the last question, and this is for both you gentlemen, if eventually the funding comes down from the federal government, how do you ensure that the state doesn't say, well, the counties and the local governments got direct funding from the federal government, so we're going to take a little bit off the top back to cover our gap?
You can't. There is no guarantee. I mean, quite frankly, and I'll Marc close, but I'll be this guy. The state legislature gave the governor a great latitude. Some of it, entirely appropriate, and some of it is an overreach. There needs to be that sort of checks and balance within the context of budgeting. But the short answer is we don't know. And the reality is there is a financial burden and impact to the state of billions upon billions of dollars that the state's going to have to confront. We'd certainly hope and ask that not much of that be balanced on our backs, keeping in mind that the 2020-2021 state budget includes already some shifted costs. This was in the context of knowing what was coming next. For my county, it's several $1 million worth of new expense from the state. I get it. I don't like it, but I'd like that to be it, and that we all kind of get our ships in order. The other is, and the governor has sort of, I'll use the term ruminated about it as it relates to education. The truth of the matter is government in some ways has been a little bit outmoded for a while, and under the circumstances hasn't been leaning on technology as well and as effectively. I would hope that what we've learned in this pandemic, and again, this is not a criticism, this is the reality, we should learn something. Governments can be at every level more efficient, more collaborative, and we can use technology more effectively. And I think if as we rebuild and expect businesses and schools and others to do it, we got to expect that from government too, which should, if done correctly, reduce costs. I would say county governments, and I think Marc Poloncarz says this often, county governments are like the laboratories of democratic experimentation. We're already sort of as efficient as you get. There's always room for improvement. But I think that if we're going to get ourselves back on our feet as governments, now's not the time to shift cost or to balance the burden on someone else. Now's to summon the resources, summon the political will, and collaborate to get to be as effective and efficient as possible while slowing the hemorrhaging as greatly as we can.
Let Marc
Next question.
Thanks, Marc.
Welcome to the Marc and Marc show.
Next question is from Bernadette Hogan from the New York Post. Bernadette, your has been unmuted.
Cool. Hi guys, can you hear me?
We can, and we can see that hat.
Yes.
Oh my God, I look crazy. I'm so sorry. But I have a couple questions, also like Ryan. So regarding reopening plans, are you guys worried with, as the testing and tracing ramps up, that this could impact reopening? So you guys, like, in your specific counties, hitting those boxes, because presumably as cases go up, then wouldn't that also show a spike? And then, yeah, just, I guess, are you worried that this could impact reopening for businesses, et cetera? And then also, as the summer months come through and people are encouraged to go utilize their second homes or just tourism opportunities, are you also worried about that kind of overload? But at the same time, could that be welcomed with revenue into the counties? So just wondering what you think about that. And then I have a follow-up afterwards.
Well, with regards to the testing, I'm less worried about it. We're really keeping an eye on hospitalizations. That's the key. I mean, the testing is important because we need to know who has the COVID-19 and then do the contact tracing. We do anticipate that with additional testing, we will have additional positives, and that's what we've been seeing. But the other thing too is that we've been keeping an eye on, and we've been sharing with New York State, is the contraction rate. So based on the number of people we test, what percentage of those are testing positive, and what we've seen as we've ramped up testing is that percentage has actually gone down. Not a big surprise, because the individuals we were testing first were first responders, essential personnel, healthcare workers, which have a greater propensity of being exposed. So I'm less worried about the testing aspect of it, is more of, once we reopen, what's the impact going to be on hospitalizations? Are we going to have a surge? And we've been able to keep in Erie County, among the hospitals that we have, and we have, I think, 9 hospitals in total, of 3 major hospital units and 1 independent one. We've been able to always keep our beds at a 30% capacity. So there's always been total beds available of over 30% and ICU beds available over 30%. That's the key. If that number starts to go in the other direction, where we have less than 30%, then I'll know that opening up has caused a problem.
I'll offer that first. I don't know that we worry about anything. We plan and respond, planned and respond, plan and respond. And so my point is that the variables are so great that we recognize that as the weather changes, people are going to naturally want to travel, period. And getting them to do something that they inherently don't want to do, by telling them something they don't want to hear from people they don't necessarily trust, is not going to change the outcome. So instead, we tell them what best practices are. Stay home, slow the transmission, social distance, and acknowledge that certain things can't happen. That said, we're going to react to what conditions there are. I am concerned that the public's desire to get tested or be tested may begin to wane significantly, certainly among those communities that have been in the midst of this now for 60 days. So meeting the standard is one thing. Making sure we know the data is entirely something different and more important. So we do have a concern that there just will be a drop-off of people's desire to be tested. Therefore, we may not meet that particular standard, and worse yet, we might not know the breadth of the transmission of the disease as we enter a time when people are naturally going to want to move around. We're just going to have to be very clear with residents as to what they should expect and what we hope they do. Now, to the point about tourism and what have you, yeah, it's just a double-edged sword. I mean, our economies are very much dependent on tourism, the tourism economy. We'll have to be creative as things reopen, and there'll be the right time. But the reality is, certain mass destinations are just not going to function during the summer months. That is the reality, and that is honest. And so I think at the end of the day, we're just going to encourage people to be considerate for the health of others, to be responsible in their own activity, and to be patient, and expect that we can monitor. To Marc's point, our biggest data point is who's in the hospital, how severe is it, and for how long. That's the data point that we'll monitor the most aggressively, because the numbers of people testing positive is important. The numbers that have to enter a hospital or be in a hospital with a degree of severity is the most alarming, and that's what we have to monitor moving forward.
Next
Marc?
question is for Amanda Fries from the Times Union. Amanda, your mic has been unmuted.
Hi, everybody. Can you hear me?
Yes.
All right, great. Dutchess County Executive Marc Molinaro, you had mentioned how the initial plan that was released by the governor was kind of a roadmap. And maybe, Stephen, you can also speak to this. Are there other county executives who want to retool how exactly this plan is being approached? Obviously, in the Hudson Valley, there's been a switch. Are there other areas that are also looking at that? And also, I'm very curious whether the governor has held any conference calls with NYSAC and executives across the state when it comes to formulating the plan that came out.
I think the manner in which the governor is communicating needs to change. As we said, I said earlier on, that when the crisis first hit the state in early March and mid-March, when the state acted, the governor immediately using the executive orders and powers and really need to centralize the situation, because that's what required, that was what was required at that time. As we go through the reopening and the further discussions of how to communicate the state's plan to meet these 7 criteria, more importantly, how to have people return in some manner to work, how they will work, will it be staggered, will the unions, we have to work with our public unions on shifts, how it all works, that the manner in which the governor communicates needs to change, and it needs to be more direct conversations with the regional leaders if the state is going to be successful. We can't afford for this to fail. And the county executives are in a position to regionally execute the state's plans. So the manner in which and the amount of which communication needs to change, and I believe that it will. Regarding the regions of the state changing and realigning, that's something folks are looking at. I think County Executive Molinaro talked about why the Mid-Hudson and the Lower Hudson makes some sense. We do see some of that in the southern tier sections of the state. I'm not sure how they feel, but in some of the southern tier sections of the state, they may be looking to have some realignment where there's more similar patterns or relationships amongst the counties.
I'll say as the home county of one of the greatest American presidents, and someone the governor and others like to quote often, Franklin Delano Roosevelt, I'll paraphrase in suggesting that we're not retooling anything. We're suggesting that you try something, and if it doesn't work, try something else. And so from my perspective and our perspective, the framework that the governor outlined is, by the way, rests a little bit on the CDC and the White House plan. So that's to be acknowledged. And it's an iterative process. We'll try, and if it doesn't make sense, we should try something else. And by the way, as Steve has mentioned, and I think I've said multiple times, and I do believe it's really important, I don't want it underestimated. We are in a different phase of response, and thus a different phase of communication. You need to be clear, specific, and honest with your partners and with the public in order to get the attention, the respect, the response that we need. And so, that I think is what we're looking at in the Hudson Valley. The governor has referenced this. He's often said Rockland, Westchester, and then upstate. In fact, there was a whole slide that said Rockland, Westchester, and then rest of state. I've never been so happy to be called something so insignificant. As rest of. That said, those are the kinds of things that we're looking at. And to the very specific point, the answer is no. We haven't had a collaborative, all of us on the phone with the governor call. But that doesn't mean we haven't had calls ad nauseum with senior staff. We all have the relationships that we need. There's value to that. There is value to having the commander-in-chief on a call among the field generals. And that, I think, is the phase that we may want to transition to. But we had those conversations, and I'll take this moment to say, because I've said it out loud, and it did mean something to me. That is not to say that we've not spoken to the governor. And of course, in my case, we had a very decent and somewhat lengthy conversation after the passing of my father. And I only offer that in that, we all have a job to do. We're all sharing the responsibility, but we also have a degree of shared humanity. And during this crisis, this pandemic, I will tell you that we may not have been on the phone, all of us together. We've all found the time to figure out how to communicate. But I do think we've transitioned to a phase where, once every so often that would be useful, because we're going to be the ones on the ground implementing a lot of these very complex decisions.
I have one other question. When it comes to the antibody testing, it seems like there's kind of it's fallen to the wayside a little bit. We don't really have specific data on a county by county basis. I don't know if either of the Marcs on this call have any thoughts about whether that's something that needs to be focused on, or if attention should be shifted elsewhere when it comes to responding to the pandemic.
Can I answer quickly, Marc, and then just to say that right now when we list recoveries, and I think Marc does this, Marc's talked about this and changed his database and I'll stop. When we list recoveries, it's sort of a guess, right? You've extended the protocols or the period of time you're supposed to be with asymptomatic or on quarantine. The antibody testing is very, very valuable. We believe that data will become more available, and if it is, we'd like to be able to share it.
Yeah, Marc is correct. We were, at one point, we listed recoveries, and then we realized that they were based on self-reporting, as well as individuals who had been recovered, ended up back in hospital with COVID-19. So we felt that it wasn't appropriate to continue to list recovered when it wasn't an accurate number. And on the antibody testing, our public health lab, and Erie County is one of only 3 public health labs that exist in New York State, between Albany's Wadsworth for the state and New York City's. We are authorized to perform the Abbott Labs test. This is an actual blood draw test. It's not the finger prick test that I think there's some question as to the viability of that test. So we are doing the full antibody testing, and the antibody test results we've had so far show that less than 10% of Erie County's population has been exposed. So that's a concern, because if we've had over 300 deaths in our county and nearly 3,000 positive cases, but less than 10% of the population has been exposed, what's going to happen is more and more people are exposed. That's why we keep track of the hospitalization data and the like. The one thing that a message we're trying to get out, and my health commissioner is really trying to get out, is just because you have an antibody test and it comes back positive does not mean you're immune. There's cases we're seeing across the world that shows that individuals who had bad case of COVID-19 months later come up with another case of COVID-19. And there seems to be, once again, this perception among many in the public that if I contracted in the past, I'm safe. And we know that's not the case. So we're trying to continue with that message. And finally, the other thing that is important is, just like the original PCR tests, there was delays. We had a few thousand tests that were coming in from Abbott Labs, and we've put in a purchase order of 100,000. And now the next set of tests we're supposed to get, the sample kits, are delayed because there's such a demand for it, not just in New York State, but across the whole country. And if you think about it, the same thing with PPEs. It's not a demand that I'm trying to get PPEs and I'm fighting Marc in Dutchess or Adam Bello in Monroe. We're fighting people who are trying to purchase it in Europe, in South America, in Asia. And I think the same thing is going to start happening very soon with the antibody testing, is that they're the ones that are officially approved by the FDA, and that's still a very small amount, including the Abbott Lab test one that we do. Everybody's trying to buy it, which means there's a backlog in receiving the actual kits so that we can perform the tests. We're really focused on ensuring that we keep the contraction rate down so our hospitalizations don't go up. We're going to continue to do all kinds of testing, but I'm very worried with regards to the antibody testing that if we do see the numbers still track at less than 10%, that means more than 90% of my population hasn't even come in contact with it. And that scares me with what potentially could happen in the future.
Okay, we're going to need to wrap it, Marc. So if we can just if there's any more calls, let's try to keep it to just a few minutes here so we can conclude the event.
Yes, thank you, and thank you for your time, county executives. We have 2 more questions that have been in the queue since we opened up the Q&A. So the first one comes from WKBW TV. New York State has determined what are the essential businesses and which phases of reopening they are assigned to. But some local businesses wonder why the decision of what is essential is not made on a local level, because individual counties know what is best for their community. Marc Molinaro, do you want to talk about that first?
We've assembled a small business reconstitution team led by our economic development group, we're going to give our input. We believe there are certain businesses that may not be clearly identified in any of those phases. We're going to offer what guidance and protocols make sense for them to reopen at any given stage. We've done that actually for a couple manufacturers as test cases. And quite frankly, I'm comfortable with the state establishing sort of broad expectations, and I'm also comfortable pushing up against those expectations to be clear that we can meet certain requirements with certain safety precautions. So I do think that there needs to be local input. I think there is local input. Frankly, we're able to give it, and we're going to give that input. And I hope that will be collaborative in the way we finalize some of the decision making.
I believe it was Ed Riley on from WKBW. Ed, I think what we need to realize is we are working with the state. I'll give you an example. There's all these protocols, but the governor's also talking about what the businesses need to do to reopen. So the conversation I had with John Majori from the governor's office yesterday is there a template? Because I think everyone believes, well, I'm in my own little community. I know what's best for my little community, but we also have to understand that this is a virus that can be spread regardless of what community we're in. And there's many businesses that have locations all across New York State. So it would kind of be silly to have the portions of the businesses open in one section, but be closed in another. So what we're trying to do is get from New York State a template. What's the template that businesses need to respond with to show us that they're meeting the protocols and the standards? I don't want to go forth and say businesses in Erie County and in Western New York, in consultation with my Western New York partners, have to meet this 15-part test, and then have our friends in the Hudson Valley or the Mohawk Valley come back and say, well, we have a 5-part test. So that's really something that does need to come from New York State to say, for businesses to reopen under the plan, here's what you need to show your local governmental officials. So that's what, as I said yesterday, I talked to John about it, and his response was, I think they're working on that. Let me go check, and hopefully we'll have a response for you soon, because any community is going to need that if they're going to be able to open by May 15th. I'm personally of the opinion, because of the issues we dealt with in Erie County, that we're probably not going to open on May 15th, but I think we have a very good chance of opening on June 1st. But we need to have all these things in place, and the state is the best party to provide that.
Thank you. One more question. The last question goes to Dan Clark. Dan, your mic has been unmuted.
Hi, Marks. How are you?
Fine.
Good.
I just have a question for clarification, so it should take 2 seconds. So are the counties responsible for increasing testing up to the levels that are required and hiring the number of contact tracers required? Is that falling only on the counties, or is the state helping with any of that?
Well, I can go ahead. I would just want to say, Mark, that the state, it is their responsibility to do the broad-based hiring or contracting for contact tracers. As Marc Poloncarz said earlier, the counties are already in the business of contact tracing, and they're not waiting for the state's help. I'll turn it back over to you, Mark P.
Well, we had a conference call a couple days ago with Jim Malatras, Rob Mujica, Beth Garvey, and that was a question that was repeatedly asked. Are we responsible? Is the state responsible? And I got the impression we kind of both were. So I'm just taking it, saying, you know what, I'm not going to wait. I don't want anybody to point the finger and say Western New York can't open because you don't have contact tracers. I have the ability to put contact tracers in place. We have the staff already that has access to the county's workstations. They can work from home. Individuals who have access to the Healthy Link system that then puts them in, get the information with regards to the individuals, even if they're not in the Department of Health. Our Senior Services Department has access to Healthy Link. Our Social Services Department has access to Healthy Link. And we can train them on contact tracing so that we're ready even before the state is.
And can I say that? I mean, remember in New York, it is the county health department that is the arm of the state health department. In fact, that we hate it most of the time because our people are out there, enforcing state rules, and the public thinks it's only us. But that said, it's a little bit of both. But I'd be thrilled if there were contact tracers that either were reimbursed employees of Dutchess County government, or they were contracted by the state, embedded in my health department, so that I can coordinate the response. And I think the state would be most helped by a 62 or 57, I guess, if you consider the city as its own grouping of counties. the state would be better off if that was a coordinated effort with our teams working with their team, so that we can all use the same point of contact. We all can coordinate the response. And quite frankly, though, the county governments know the counties, know the towns, villages, and cities to be able to follow up on what block and what neighborhood particular case is in. So there needs to be that embedded relationship, either through contract or through reimbursement, or a little bit of both.
Yeah,
I think that, go ahead, Marc.
For example, in the city of Buffalo, we were very concerned about an outbreak on the east side of Buffalo, which is the African-American district. And we know that health disparities already exist. So I've spent a lot of time on the phone with a number of the African-American pastors, Mayor Byron Brown from the city of Buffalo, about what we needed to do to address that. And I'm very glad to say that as a result of our work, we've seen declining numbers of contraction in the east side of Buffalo, as well as declining deaths. At one point, about 33% of all the deaths in Erie County were from individuals of African-American descent. And now it's about 20%. The population of African-Americans in Erie County is about 15%. So it's still a little higher than it should be. But we have the ability to immediately realize we have a problem in a neighborhood. We've got to address it. Who's the pastor that represents the church in the neighborhood that we could talk to? And I don't think a contact tracer who's based somewhere else in New York State will have any of that institutional knowledge that we need. So that's one of the reasons why we're doing it locally. And if they come back and reimburse us later, fabulous. That's great. But I'm going to have to do it regardless. So let's just do it.
I think we're going to have to leave it there in the interest of time. I want to thank the gentlemen, the county executives, for joining us. Let me just say that the last thing that we wanted to bring up was the data that's used on the dashboard for the individual regions, that the counties need to have access to the same data set that the state is using in its measurements. And without that data, we can't understand what that means regionally. So we'll continue to use that data and understand this chart showing the different indicators here. We need to have the access to this data, the number of deaths in hospitals, the ICU beds, and even the things that are outside of our control. As County Executive Poloncarz talked about, the need to understand hospitalizations, the deaths in the hospitals and ICU beds. Those are very important because those indicators affect the entire region where millions of people live. So the access to this data, very, very important. I want to thank everybody for joining us here today, and in particular the two county executives from Western New York and the Mid-Hudson Valley. Thank you very much, everybody.
Take care. Be safe and well, all.
Thank you.